Admin and clerical colleagues play a vital role in making sure patients get the healthcare they need throughout our hospitals and community services. They help bring together our clinical staff with behind-the-scene functions needed to deliver great care for our patients. Without admin professionals, patients might not get their appointment letters or be booked in for clinics and procedures. Frontline staff would have less time to spend with patients, might not have their rotas, or even be paid. Working in the NHS means you can really make a huge difference. It's more than just a job, it's a valuable profession and can be a great long-term career. There's a huge variety of roles across the Trust. If you enjoy meeting and working with different people, a patient-facing role could be for you. Do you want satisfaction of helping patients? Medical secretaries, ward clerks and waiting list coordinators help manage appointments and bookings. If you like working independently and delving into detail with complex tasks, there's data or pathway coordinators. There's lots of other admin roles across our departments, everything from HR and recruitment, training and development and management positions. All of these roles allow you to pick up a lot of knowledge into how different systems and teams work, making you an important source of information and support for your colleagues. The experience and transferable skills you gain are really valuable and can help you develop in your long-term career. Growing and developing our staff is really important, and we want to actively support you to further your skills and career. If you have good organisation, IT and team working skills, there are many options for you to develop and progress in your career. As you gain more experience, you might want to progress up the pay bands within the same field or area. Fancy a change? With hundreds of different departments and roles, there's no shortage of opportunities to broaden your skills. If you want to take on more responsibilities, such as managing major projects, budgets, or even other staff, we can support you with the training to do this. Whether you're a new starter or an experienced manager, there are lots of training and development opportunities to suit your role. You might take on new or extra work that will give you more experience or skills, or opt to do an apprenticeship to learn on the job. We have hundreds of different online and in-person training courses to choose from. And if we don't offer it in-house, you might be able to do online learning or a college or university course. We even may be able to help secure funding for these, giving you new professional qualifications or even a degree. You can also shadow colleagues to find out more about how they work, have a mentor, or even become one yourself. I started at the Trust as an admin apprentice in laboratory medicine way back in 1996. This gave me a really good set of skills and knowledge to help me progress my career. Over the years, I've worked my way up through roles like admin supervisor, assistant service manager, operational manager, and deputy ops director. In my current role as Assistant Chief Operating Officer, I'm responsible for our patient booking hub and making sure emergency and elective admissions and processes are running smoothly across the Trust through the Senior Chief Operating Officer role. It's a really varied role that covers everything from managing and overseeing services and teams of staff, attending senior management meetings, and making sure staff have the support and the resources that they need to do their job. When I first started, I never thought I'd end up here, but admin and clerical has given me such a great foundation to build my career from, move around roles and gain a lot of experience. I'm really proud to work here and to work with so many different incredible staff, help make a difference to our patients and their care. Anyway, enough from me. Let's hear from a couple of other colleagues on their journeys with us.
I've worked here for just over 10 years now. Started working in the Trust as a temporary member of staff I worked in the ophthalmology department for quite a while, in various roles. I worked in the reception, I worked in the booking clerks there, I worked in the assisted conception unit, and then over the last 5 years I progressed in my career as a clinical coder, working in the clinical coding department from trainee coder to what I do now as a coding engagement lead. Clinical coding, it's a role that people rarely understand. We're here to capture the data of what happens to a patient during their stay. We turn any procedure or any diagnosis that a patient has, we turn it into a series of codes. The data we produce is what's used to improve patient care. The Trust's been quite supportive at all points. In ophthalmology, it was providing me with a wide range of experience that allowed me to apply for other jobs. And then the clinical coding department got quite a structured form of progression where they pay for us to do the training, various courses as our initial training course. And then we do a professional exam later in our career that they fund us through that as well. The clerical team here at the Trust is really the powerhouse of everything that happens within the Trust, from prepping the clinics so that the notes and everything are there for when people come in, to handling all the organising of appointments and to handling all the data afterwards. Nothing would happen in the hospital without them.
So I was a business and admin apprentice when I left school at 16, then progressed to a clerical officer, then a support sec, and now my current role. As a medical secretary, I work at the Northern General Cystic Fibrosis Unit. I look after 3 consultants and ensure that admin runs smoothly day to day, maintaining diaries, doing clinics, contacting patients, and just making sure everything runs smoothly. After my apprenticeship, I did my level 2 typing, which got me to my support secretary role, but then I needed the level 3. So once I completed that enabled me to go to my medical secretary role. Admin and clerical plays a big part in the hospital. From the moment a patient is referred to the moment that they're seen, there are lots of things that go on that are really important to ensure that the patient's journey is smooth. And admin and clerical, if you understand that, you feel appreciated and you know that you played a part in ensuring that patient journey runs smoothly. The Trust has been very supportive over the years. I've been able to work flexible hours, from being full-time working early shifts and late shifts. If you're enthusiastic and you're methodical and you enjoy admin, I'd totally recommend working for the NHS. It's flexible and it's just a nice place to work.
Hopefully, this gives you an idea about some of the fantastic opportunities working in admin and clerical has to offer, and how it can turn into a great long-term career.